Hello, everyone. Thanks for joining us on the media briefing today on a beautiful Wednesday. We're going to get started and talk a little bit about elections before we start on COVID today. And we're very pleased to have Gina Martinez, our Registrar of Voters, here to talk with us about what people are getting in the mail. The ballots are in the mail and they look a little bit different for this election. And Gina, I'm hoping you'll walk us through what people can expect to find. And I know we talked last night and I brought my ballot with me and I was surprised at how it looked a little bit different.
That's right, Maya. Thank you so much. It is slightly different this year. Good afternoon, everyone. Ballot packets for the September 14th, 2021 California gubernatorial election have been mailed to just over 211,000 registered voters in Monterey County. Some voters began receiving ballot packets in the mail as early as Saturday. The ballot packet contents are different this election due to the timing of the election. The voter information packet and related inserts are included in the mailing. The ballot packet, let's move forward. So this is what you'll see. Everybody can see my screen? Am I sharing okay?
Yes,
okay,
it looks
perfect.
just great.
Perfect. So the ballot packet contents include everything that you're seeing on your screen right now. There is the voter information pamphlet. This pamphlet includes a statement of reasons for the recall and a response from the current office holder, a list of party endorsements for parties who opted to endorse a replacement candidate, a sample ballot. The words sample ballot are printed on each side of the page. It is in the packet as a singular insert. Now, another difference that voters will see this year is the cover page. So there is an official cover page to the official ballot. This cover page includes voter instructions, frequently asked questions, and a list of return locations and polling places. The official ballot is folded within the cover page. And then the postage paid return envelope will also be included. Now, there are two parts to the official ballot, and this is a question that we're getting a lot as voters start opening it up and looking at their material. The first part asks the question, shall Gavin Newsom be recalled from the office of governor? This is where voters have a say in whether or not to remove the current office holder. In the second part, voters are asked to select a replacement candidate who will take office if over 50% of voters vote yes in the first part. At this point, the ballot's no longer asking if the incumbent should be recalled. The question now is, who is your preferred replacement candidate in the event that the current office holder is recalled? If over 50% of voters vote yes to the first part, then the replacement candidate with the most votes will take office. Regardless of whether or how a voter votes on the first question of the recall ballot, the voter still has a say in the second part where they're choosing who will represent them if the current governor is recalled. Excuse my transition. So now voters can return their ballots by mail postmarked on or before Election Day. The last recommended mailing date is September 7th. They can return it in person to any official ballot return box, voting location, elections office in the state by 8 p.m. on Election Day. In-person voting opportunities are available now at the Monterey County Elections Office, 1441 Schilling Place in Salinas, and beginning August 30th at the satellite vote location at Embassy Suites, 1441 Canyon Del Rey in Seaside. The Monterey County Elections Office and the satellite vote location will be open during special weekend hours, 9 a.m. to 5 p.m. on September 11th and September 12th. Polling places will be open from 7 a.m. to 8 p.m. on September 14th. The close of voter registration is August 30th. County election officials must complete the official canvass and certify results by October 14th, and the Secretary of State has until October 22nd to prepare, certify, and file a statement of the vote from the compiled election returns. Thank you.
Thanks very much, Gina, for coming on and explaining this. Have you gotten a lot of calls in? I know we have some time for questions. So if anyone has questions for Gina about the ballot or the election process, this is a great time to ask. Have you been getting a lot of inquiries from voters to the elections office?
Yes. So primarily people are calling about the two parts of the ballot and whether they can vote on the second part if they are voting a certain way on the first part. and why Gavin Newsom is not a replacement candidate. And then the second question we're getting is regarding the sample ballot. So why is there a sample ballot? And it's new to voters. So they're asking a lot about the sample ballot.
So people shouldn't be concerned about feeling like they're not quite sure. They should feel free to call the elections office. There's no harm in calling if you're confused.
Correct. We encourage voters to call us if they have questions, call us if they have concerns. If they need additional assistance in voting, we're here to assist.
All right. Thank you, Gina. And I don't have any questions in chat from anyone on the call. So it sounds like you've done a terrific job of explaining it all. And if there any questions do come in, I will forward them to you. And thanks very much for dropping in and telling us more about the vote. It's very exciting.
Thank you.
All right. Thank you, Gina. And then now we're going to move on to our COVID section. And we've got a theme of back to school today because it is that time. And if you thought last year was a little confusing, this could be another one of those years that people thought, well, there couldn't be a year like last year. And so now we're having this year, and we're very pleased to start off the conversation with Dr. Deneen Gus, who's the Monterey County Superintendent of Schools. And Dr. Gus, I'm hoping you will share some tips and information for parents who really have a lot to navigate for their children this year, no matter what age they're in.
Absolutely. Thank you so much, Mia, for the opportunity to be here today and just share what is happening as it relates to schools. I want to start off by saying I am so excited to report that 20 of our 24 school districts have already launched their new school year, and students and staff are so excited to be back on school campuses for in-person learning. They're all masked up, but I know that behind those masks, there are very big smiles. We also just want to point out that, as I mentioned earlier, everyone is wearing masks. All schools throughout the county are following the health and safety protocols, and they're really trying to get back to our new normal, or at least as normal as we can be in the midst of a global pandemic. I also want to mention that many of the schools are offering COVID testing for both students and staff. And this is super important right now because you may have heard on the news that the governor recently announced that all public and private school workers are required to provide proof that they're fully vaccinated or participate in weekly COVID testing. And this will just ensure that school workers are not bringing COVID onto school campuses. So if you're wondering, okay, who's included in the school workers group? Let me expand upon that just a bit. So school workers includes all staff and any essential volunteers who are on campus. So this mandate is meant to help decrease the spread of the virus in schools and in our communities. I also just want to take a moment to point out that at this time, 63% of Californians 12 years of age and older are fully vaccinated, with an additional 10% that are partially vaccinated. And just a reminder that children under age 12 are not currently eligible for any authorized vaccines. But I am hearing that hopefully within the next few months, we will have vaccines available for those under the age of 12 as well. I just want to say that we really need to continue our vaccination efforts because as of August 10th, less than 41% of Californians ages 12 to 17 were fully vaccinated. And this is literally our best defense against this virus. So I'm strongly encouraging our young people, our 12 to 17-year-old students to please do get vaccinated. We're also hearing from our mid to large size districts that they're having about 1 to 2 COVID positive cases each day. Now, for the most part, these cases are students that were infected with COVID while they were out of school. So we're not hearing about transmissions occurring in schools. And also, I just want to note that all COVID cases in or out of school are reported to the health department. And the schools are doing a great job with their contact tracing and their notifications. So please know if you're a parent, if you get a notice from your school saying that there has been a COVID positive case on your school, please, on the school grounds, please don't panic. Unfortunately, this is expected. We are in the middle of a global pandemic, and there will be some positive cases. But know that schools are doing everything they can to keep students and staff safe. They've got great protocols in place, and that's what's so very critical. I also, in addition to these major updates, just want to encourage students, parents, and school staff to continue to be patient and kind and flexible as the pandemic does continue on. And always remember, wash your hands, wear a mask, social distance when possible, get vaccinated if eligible, and have a wonderful and safe start to the new school year. And with that, I'll open it up to any questions.
We've got two more speakers who are going to talk on similar topics, but I do want to ask if you have a parent, there's a parent out there who just isn't sure about something, wondering about their school's COVID program, wondering what they should do, what is the best course for them if they just have a question and they don't know where to turn?
Oh, that's a great question. So first, they should visit the website of the school that their child attends, because all of the school district websites do have their COVID safety plans posted right there on the website. That will lay out all of the health and safety protocols that the school will be following. But then if they still have a question after that, they should reach out to the school administration, and they can, again, find the contact information on the school's website, or they can just go to the school administrative offices where they will be able to speak to a school administrator who will answer any of their questions.
Thank you very much, Dr. Gus. And if you could stay on the line for questions, that would be terrific.
Absolutely.
Our next school topic is not necessarily in school, but getting to school. So we're very pleased to be able to talk about the Safe Routes to School program today with Jessica Perez, who's a chronic disease prevention coordinator with the health department. Hi, Jessica. Tell us a little bit about Safe Routes to School.
Hi, everybody. I was just going to say that we're trying to keep parents and families and the community safe in a different way, and that's with them getting to school and home safely. I'm going to be sharing my screen right now. So again, I am the coordinator for the Safe Routes to School program, and I'm going to be sharing some messaging that we hope that can reach parents, families, and keep everybody safe. One of the first things that we like to do is focus on prevention. I think working together, we can all get everybody home safe, everybody to school safe, and that includes drivers, pedestrians, and cyclists. And we want to prevent collisions between pedestrians and drivers and cyclists and drivers. One of the pedestrian safety activities that we conduct are walking school buses, which is an adult supervised walk to and from school, educational presentations to parents, students, community. And just recently we started to conduct these stencil art projects, which route a colorful map route to school from a centralized location. We started in South County, and we hope to expand that project to the Peninsula, Salinas, and North County schools. So as you can see, the pedestrian safety, pedestrians are also guilty of being on their phones and walking. We've seen a lot of headlines of people walking and getting injured. So staying off the phone is key. Looking on all directions for cars, and staying on the sidewalk. If there is no sidewalk, we encourage them to walk facing traffic. And of course, wear bright clothes if you're walking at night so you can be seen. Make eye contact with the drivers in order to know if they're letting you go or if they're planning to keep driving. And of course, the dart outs, those are pretty common with little kids who are excited to either get to school, leave school, and so they dart out and not necessarily using the crosswalk. So be vigilant of those. The bicycle safety, we conduct also educational presentations. There are bike rodeos that are offered through some of our grants at some of the schools that we work with. We provide helmet inspections, fittings, distributions. We will be at community events like the one that's coming up for Ciclovia on August 22nd in Soledad. We will be there giving out helmets and educational material having to do with pedestrian and bicycle safety. Again, one of the things that we like to focus on is having everybody wear helmets. So, and not necessarily just wear a helmet, but a properly fitted helmet. And we do the inspections. We provide helmets not just for kids, but also for adults. Another thing that we have been focusing on and offering are the bike repair workshops that have been taking place in Greenfield. And with that, they community members learn how to inspect their bike and make sure it's in good condition to ride and be safe. And then the school zone safety. I think it's important to focus on this as more families and students are out walking to and from school with the in-learning education going on. Follow the school rules for drop off and pickup. We have in the past partnered up with police departments in order to be patrolling the areas during these times, just because it's the most hectic time around the school zones with walking and parents picking up and dropping off their kids. Stop for school buses is an important one. There's kids crossing the road, and if there's a bus with the red flashing lights, you need to stop. And of course, follow the speed limits. And distracted driving has increased. And also there has been an increase in speeding, even though there was less drivers out on the road during COVID, there's increase in speeding according to the California Office of Traffic Safety. And all of these graphics come from the California Office of Traffic Safety website of Go Safely California, which is on this last slide. Here is my contact info in case anybody has any questions later on.
Thank you very much, Jessica, for a really great comprehensive program. We want to be safe in school and outside of school and on the way there. And if you would stay on the line for any questions people might have, that would be great.
Thank you.
And then we're going to talk a little bit about the digital divide, which last year's school year really brought to the forefront about, remote learning and the need for digital support. And Monterey County has been working very hard on that. And we're very pleased to have Alex Zhang, Division Manager with Monterey County Information and Technology Department, to give us an update on what you have been working on. Hi, Alex.
Hi, Maya. Good afternoon. My name is Alex Zhang. I'm the division manager for the Monterey County IT department. I'm glad to be here to report to you progress made by Monterey County on the digital divide. Are you able to see my screen?
Yes, I am.
Great, thank you. Monterey County has serious digital divide problems. There are, however, significant broadband development efforts at all government levels, including Monterey County. Monterey County received board referrals to support collaborative efforts to address the digital divide issue in partnership with the local school districts, cities, other county departments, and community partners, and to advocate broadband solutions at the state and federal level. In response to the referrals, Monterey County IT department worked with the community partners and proposed broadband solutions to the board on June the 2nd, 2021. As a result, the board approved $1.93 million in ARPA funding for fiscal year 21-22. Subsequently, a request for proposal is developed and will be released in the next 2 weeks. This RFP will invite qualified vendors and partners to build, deploy, operate, and maintain broadband services to unserved and underserved areas within Monterey County. This RFP is part of the county's initiative to conquer and close digital divide and to encourage the deployment of a regional broadband network so that every household and business within the county eventually will have access to broadband. I'd like to emphasize that, the scope of this RFP is to address the broadband needs in unserved and underserved area first. Second, the Monterey County ITD is engaged in another project to provide free public Wi-Fi to county residents around 24 county sites and buildings. This project will benefit county residents and provide free Wi-Fi to residents within 328 feet beyond building perimeters. Note that most of the libraries already have public Wi-Fi. Expected completion date of this project will be September this year. In addition, Monterey County ITD created a dedicated broadband page on county website, which has contents related to the list of the free and discounted internet services, broadband coverage map within the county, and broadband survey. So in front of you, you see a screenshot of this page. We also worked diligently on a county referral or board referral regarding facilitation of the regional governance, strategy, collaboration, and partnership on expanding the broadband access and closing the digital divide. On July the 20th, 2021, this year, Board of Supervisors provided directions for us to form a regional broadband task force that our department is actively working on. The task force will collaborate on regional broadband needs and identify coverage gaps, and to create a Monterey County strategic broadband plan, and to agree and implement the appropriate governance body. So this concludes my report. Thank you, Mayor.
Thank you, Alex, very much. And if you could stay on the call for any questions that people might have, it's really great to see how this project is moving along.
Sure.
And now we're able to have some people on that I wasn't sure we were going to get to, but we are very pleased to have Dr. Christopher Burke on the line. He is the medical director of the emergency department at Natividad. And I was hoping that he might be on today to talk a little bit about COVID testing and about what his emergency department is seeing with parents getting their children tested in the emergency room. Hi, Dr. Burke.
Hi, good morning. Thank you for having me and allowing me this opportunity to speak with this group. And thank you for all the work you guys do that isn't always seen. So we appreciate it. I want to talk just briefly about COVID-19 testing, especially for concerned parents of students. So this week, and especially Monday, we were really hit hard with a number of parents requesting COVID swabs for their children who were told they needed one. It caused quite a, for us, and I know the other hospitals in the county, it caused quite a backlog, and kind of, we had our busiest day on Monday in our entire history of the ER at Natividad, and it continues this week. I just wanted to encourage everybody to get the word out that the ERs are not really a great place to come to get tested for COVID. If you or your loved one feel you have symptoms and need to be treated, we are happy, and that's what we're here for, is to take care of that. But if you're just coming to get tested, it's not very efficient, and it actually blocks care for other people who need the emergency department. So we would just encourage you to encourage people you come in contact with to go to the county testing sites that can be found online, and it would really help out all the patients in the community, in the county.
Thank you very much, Dr. Burke. I was, when I heard this, I was really surprised, but for parents who need the test, they might think of the emergency room as the first place to go. if they didn't know otherwise. Is there any other updates you can give us from Natividad on the current COVID cases there?
Sure, yeah, and we just want to say, I mean, it's totally understandable. You go to where you know you can get the test, so it's a totally understandable thing. Just also, I see, I think Dr. Moreno is on the line. There is from the county, the student COVID-19 exposure kind of protocol, or I'm not sure what plan for isolation and when to get tested. So that's also out there that can be referred to. But in terms of COVID itself, we are definitely seeing more than we were a month ago. Not nearly as much as, say, over the winter, January and February, but we're worried that we may get there again. Overwhelmingly, the people who are sick enough to get admitted are people who are unvaccinated. So we, again, would really encourage everybody to get vaccinated, and anyone you come in contact with, please encourage them to be vaccinated. It makes a big difference. But we are reopening all our COVID protocols, and I know SCMH and CHOMP and me also are very are reopening everything, and so we're ready to care for this pandemic once again. But we are very busy because over the winter, a lot of our non-COVID patients stopped coming, but now we are starting to see all of our regular patients again on top of the COVID. So it's making for a very busy time, but we are ready to handle it.
Thank you very much, Dr. Burke. And for those who are putting in questions, I just want to remind you that we'll take our COVID questions after all of our presenters. And Dr. Burke, if you would stay on the line, I'm sure there are going to be some questions for you.
Absolutely.
And we're also very pleased to have Dr. Moreno with us, and he's got an update for us. And so, hello, Dr. Moreno.
Yeah, hi, Matt. Good afternoon. All right, so Ed Moreno, Monterey County Health Officer and Director of Public Health. So as far as our COVID cases, we still have continue to see a slight increase in cases. Statewide, the state is reporting the case rate is 26.6 per 100,000. And the positivity rate is 6.1%. That's actually down from 6.5% the week before. And I believe that was down from 7 the week before that. So it appears that there's a slight decrease in the positivity rate, but the case rate is still elevated. As far as case rates between comparing case rates among unvaccinated Californians and vaccinated Californians, I don't believe the state has updated the data there since August 7th, but it does point out that the case rate among unvaccinated individuals is 51 per 100,000, and the case rate among vaccinated individuals is 8 per 100,000. And so the individuals that are unvaccinated are much more likely to get COVID-19 compared to people who've been vaccinated. Here in Monterey County, we still have an elevated case rate. It's 12.2 per 100,000. Which is up slightly from 10.4 the prior week. And our positivity is 5.3, which is up a little bit from 4.7 last week. And again, that means more or less around 5 out of 100 people that get tested, about 5 are testing positive. Let's see. And as far as the hospitalization rate, it's been going up and down. It's 33 today. But there has been some increases and decreases, but it's still elevated, and that includes 6 patients in the ICU as reported from the hospitals to us. But the most important thing I want to point out about this data is it confirms it's consistent with what we're not only learned about the vaccine during the clinical trials, but what we've learned from studies of vaccine efficacy since the vaccine is made available under the authorized use. And that is, studies are showing that the vaccine, messenger RNA vaccine, for example, messenger RNA vaccine is about 94% effective against the alpha variant against symptomatic disease, and it's about 88% effective at preventing disease from the Delta variant. And similarly, the messenger RNA vaccines are about 95% effective at preventing hospitalization from the Alpha variant. And now that we have the new Delta variant, it's about 96% effective preventing hospitalization with the Delta, due to the Delta variant. And this would be consistent again with what we're hearing from our hospitals, that most of the people that are getting hospitalized are unvaccinated. Fine, let's see a few more things. We have on the variants, we have in the month of July, which I think we've we may have received nearly all the reports for genomic testing. We have about 91% of the specimens sequenced. 96% of the specimens sequenced were of the Delta variant, and thus far in August, we're only finding Delta variant from genomic sequencing, or in other words, 100% of the specimens that are sequenced are turning up to be the Delta variant. So it's not only is it the predominant strain, it appears to be possibly the only strain we're seeing at this point among the specimens sequenced. And again, it's very important to get vaccinated and use face coverings, because this variant is more infectious than previous variants. And then let's see, I think I'll finish up with a couple more things. As far as vaccinations, Maya, let's see, we continue to make progress in the vaccination efforts county-wide. That's the Monterey County Public Health efforts, in addition to all the other vaccine provider efforts. We have about 76% of the eligible population receiving at least one dose in Monterey County. That's includes a 1% increase from last week in each of the 4 regions. So an increase in South County, North County, Peninsula Big Sur area, and the Salinas region. And the biggest increases over the past week have been among those that are 12 to 17, with about an additional 3% of that population being vaccinated. And then also in the 18 to 24 and 35 to 44-year-old groups, an additional 2% have been vaccinated. And good to hear that in South County, where we have some of the lower rates, an additional 2% of South County residents have been vaccinated. So again, we continue to make progress across the county, and we've had a slightly bigger increase in certain populations locally. And I think I will end, I'll end with just some update on the FDA and ACIP recommendations to further protect those that are people who are immunocompromised. So the problem there is that immunocompromised individuals are at higher risk for severe illness, for prolonged illness, and prolonged shedding, meaning that they shed the virus longer than other people, which leads to increased spread among household contacts, and also viral evolution, which means that the longer a person is infected, the greater the chance that the virus will undergo another mutation. So we also know that immunocompromised individuals, according to the ACIP, have about 35 to 95% less antibody response to the vaccines compared to people who have intact immune systems. And that probably helps to account for the fact that a lot of the post-vaccination cases are among immunocompromised individuals after they've been vaccinated. And they also account for a large percentage of the hospitalizations, according to the ACIP. They're overrepresented among hospitalized post-vaccination cases. So knowing that in the midst of an increase in cases and hospitalizations here in California and across the nation, the FDA authorized an additional dose of a messenger RNA COVID-19 vaccine. And that's been published now. Its recommendation is to be given at least 28 days after completion of the initial 2-dose series. In addition, the Western States group also met, and they also supported the ACIP recommendations for an additional vaccine, a 3rd dose for people who are immunocompromised. And they also pointed out that the vaccines are still recommended for women who are pregnant or who have recently delivered. And so they pointed out that that's really important to vaccinate that population because they're relatively immune compromised as well. But here in Monterey County, here in our public health bureau, we do recognize that we can now provide that third vaccine to people who meet the ACIP and FDA criteria. So anyone who's moderately or to severely immunocompromised, who's already received 2 doses of either Moderna or Pfizer, can receive a 3rd dose. You can do that by contacting their medical provider, or they can visit a local pharmacy, or they can go to the myvaccine.com or MyTurn website to schedule an appointment. We recognize that different vaccine providers could have different registration requirements, but here at the Public Health Bureau, we're asking that people state that they meet the CDC's criteria for a 3rd dose. We don't necessarily will require a doctor's note to get the vaccine, recognizing that we don't want to create additional potential barriers for individuals who qualify for this and could benefit from an additional dose of the Moderna or Pfizer vaccine. We just make sure people understand they have to wait at least 28 days from the 2nd dose before they can get their 3rd dose. And at this time, there is no recommendation for giving a 3rd dose or an additional dose to individuals who received the Johnson & Johnson's COVID vaccine. And that is my update, Mia.
Thank you very much, Dr. Moreno. And if you would please stay on the line there, I do have some questions for you, but I've got a couple questions, I think, for Dr. Burke, and I want to get those to him before he may have to drop off the call. Do you know how many vaccinated or unvaccinated people are currently hospitalized at Natividad?
Hold on, I can pull that up right. So I believe we have either 7 or 8 COVID positive in the hospital admitted right now, and one of them was unvaccinated, but that person had multiple medical problems.
All right, and then Dr. Moreno, is there more information about for other hospitals? How many are vaccinated or unvaccinated?
I don't have that information, but those questions could be directed to the hospitals.
Okay, all right. Well, and so for the person who asked that question, I'm going to refer you, the other hospitals are posting a lot of their information. We've got the Natividad information for you. You may have to check with the other hospitals for additional information. So I'm going to go back to some of the questions that have come in. For the first person who asked for our elections department, our registrar of voters has dropped off the call. I knew she had to go. I will forward your question to her. So let's go on to our first questions, and this is for, these are questions about the vaccine booster, Dr. Moreno. When will Monterey County start receiving supplies of the vaccine booster?
Thanks, Mia. So thank you for the question. To be clear, this is not a vaccine booster. A booster, and to be clear, a booster was used for a vaccine that is given months to years after an initial series. This is, and typically it's among people who have normal immune systems. So this is called an additional or 3rd dose. And the reason is because the FDA recognizes that individuals who are immune compromised don't mount the same type of immune response that someone does if they have a normal immune system. So it's a 3rd dose in order to try to stimulate an increase in or an antibody response in the people who receive it. As far as the source of the additional dose, there is no separate delivery of the 3rd dose. The doses that are given for the 1st and 2nd doses, we use the same vaccine that we're using for the 3rd dose as the vaccine that we give in the 1st and 2nd dose. So it's the same vaccine, the same Moderna vaccine, the same Pfizer vaccine. So vaccine providers in Monterey and California and across the US will be able to use their current inventory of vaccine to offer the third dose.
Right. Thank you. And then I have another question for you here. There are proportionally more COVID cases on the Monterey Peninsula than during earlier surges. Are COVID-19 positive summertime visitors and tourists on the peninsula causing the virus to spread to peninsula residents in much greater numbers than before? Or is something else, could something else be to blame for the rise in cases on the peninsula?
So we have, thank you for the question. So we, what we know is that there's a rise, there's been a rise in cases across Monterey County, not just the peninsula. And at this time, I can't say whether or not it's due to particular visitors to the peninsula area. But I just want to point out it's still very important for people to, first of all, get vaccinated, and also just take measures on their own to protect themselves and others from COVID-19 wherever you're at. So that includes using a face cover if you're in a crowded setting to prevent spread of COVID-19, and as much as possible trying to limit the amount of time you're spending with people that aren't from your own household. So again, we're seeing an increase countywide, not just on the peninsula. I think we all can continue to take measures, including primarily getting vaccinated, to reduce the spread of COVID.
Thank you, Dr. Moreno. And another question for you. How many COVID-19 breakthrough cases in Monterey County has the health department verified so far?
Thanks, Mayor. So we still have small numbers for that. So we're still looking into that. We still have data to collect. So at this time, I don't know that I can provide an answer to that, but we're still working on that and trying to improve the data and the quality of the data. But in the meantime, I think it's what's important is to look at probably at the state data. And although it hasn't been updated since I think August 7th, I think it makes a very clear case that individuals who are unvaccinated are much more likely to get COVID than people who are unvaccinated, than people who are vaccinated.
Thank you, Dr. Moreno. And then I've got a question here for Dr. Gus, and I know you answered this question, Dr. Gus, in chat, but for people on Facebook or YouTube who are interested, what kind of programs or following school districts do, sorry, let me try to read this again. What kind of programs or following the school districts do with isolated students that might be exposed to the virus, and then they should stay at home for a quarantine period?
So that's a wonderful question, and it's going to be a little bit different depending on each district. So some districts are offering an independent studies program, and parents are opting their children into that independent studies program. I just want to note that not all districts do have this program, but many are partnering with other districts who do have the program in place, and that's one possibility. The challenge with that is if a student is following one particular curriculum and then they need to be out for quarantine for a very short period of time, and again, the time for quarantine is dependent on multiple factors, whether or not they whether they're symptomatic, asymptomatic, if they've taken a COVID test, what the results of those COVID tests are, whether they're vaccinated, not vaccinated. There's like multiple factors that need to be considered. And I think Dr. Moreno can probably respond to that piece a little bit better. But I guess what I'm trying to point out is if you're in an in-class setting and then you need to be out for 10 days, then whether you want to actually participate in an independent studies program that might have their curriculum at a different pace might be a bit challenging. So it kind of depends on the situation and the school district and how long the student is going to be out. But if it is a longer period of time, many students are opting into the independent studies program. Sorry, that's not the best or clearest answer. It's just there's so many variables and each district is handling it just a little bit differently. I hope that answers the question to the, to the person asking it as best as I can possibly answer.
Well, I think this goes back to every parent staying connected with their school, and finding out the protocol and really knowing, what your child, may or may not need to know or experience or be during this year.
Exactly. Exactly.
Thank you, Dr. Gus. Our next question is for Dr. Moreno. This is again on vaccinated people and hospitalization. Are we seeing an increase of people that are vaccinated in the hospital? And how many of those vaccinated have had positive test results? How important is the need for the booster shot? Or again, you're not calling it a booster shot, the third dose.
Yeah, thanks. So we do have across California, we are seeing what was a trend, which is that as a greater and greater proportion of the population gets vaccinated, we can expect to see cases among those that are vaccinated and hospitalizations among those that are vaccinated. Here in Monterey County, again, we're dealing with relatively small numbers, so it's difficult to come to any conclusions, and that's why the information at the statewide level is so helpful, because the state can take information from small and medium health jurisdictions and combine it to provide some more useful data. The point I want to make here is that the likelihood that someone who's been vaccinated of getting hospitalized or dying is significantly less than the risk among someone who is unvaccinated. And even though we will be seeing some people who are unvaccinated needing hospitalization, overall, the large group of people who are vaccinated are still much more protected against hospitalizations and fatality than people who are unvaccinated.
Thank you, Dr. Moreno. Another question for you. How many Monterey County residents are fully vaccinated?
That information, I believe, is on the CDC website. So what I can share that web page with you to share, Maya. I think there was another question. Another part of the previous question I didn't answer, and that is how important is the third dose. I think what we've been presented with from the ACIP based on studies is evidence that shows that again, people who are immune compromised are less likely to mount an immune response than people who have intact immune systems. And the third dose in studies, the third dose has been shown to mount an antibody response in, I believe it's about half of the people who received, half of the immune compromised folks who received a third dose. And so although it doesn't guarantee an increase in antibody levels, a significant portion of people who are immune compromised who get the third dose do increase their antibody levels. So that is that may represent an increased immunity to COVID among the immunocompromised individuals, and we'll hope to see over time what exactly the protection is among the immunocompromised to receive a third dose once we start seeing more people accepting a third dose.
Thank you, Dr. Moreno. And for people who are asking about numbers of hospitalizations at our local hospitals, we were fortunate to have Natividad on the line, and our friends at Salinas Valley are listening in today, and they are telling us they have 12 COVID patients there. But we will have to look towards the health department or another avenue to get vaccinated or unvaccinated information on that figure. I have no other questions in the chat. Are there any other last questions for any of our presenters today? Then if I have for follow-up, I'll be sending out follow-up information for questions or additional information that we weren't able to provide. Thanks very much, everyone, for joining us on the briefing today. Really great topics and information. We'll see you next week.